Hello friends, welcome back to my channel. In today's video, I will be talking about one of the very high yield topic, that is giant cell arteritis. And as usual, there will be a small story, and with that story you can answer any question related with this topic. So let's begin. So when I say giant cell arteritis, you should remind yourself of this story involving this big carrot. So giant carrot should remind you of that this disease most commonly affect the branches of carotid artery. Okay, so carrot for carotid artery. And you see, as I have featured this elderly female, so this most commonly occurs in the elderly female, usually more than 70 years of age. That's why I have shaped the cane with us like 7, so that should remind you of the more than 70 years of age. Okay, now talking about the presentation, apart from the non-specific symptoms, that is fatigue, fever, weight loss or myalgia, the main unique symptom of this disease is unilateral headache, which is associated with temporal artery tenderness and jaw claudication. Okay, there can also be irreversible blindness due to ophthalmic artery occlusion, so that's why I have painted one eye black. That should remind you of the irreversible blindness. Okay, there is also one of the associated symptom, that is polymyalgia rheumatica, which is presented by the girdle pain. That's why I have painted the shoulder and the pelvic girdle red. So that should remind you of the association with the polymyalgia rheumatica. Okay. So the main pathological finding involves the media, where you can see numerous granulomatous inflammatory lesion, and apart from that there will be fragmentation of the internal elastic lamina. That's why you can see the pink stripes should remind you of the fragmentation of the internal elastic lamina, and there you can see a lot of granulomatous lesion in the media. Okay, so these two major pathological features are mostly asked in the questions. And talking about the treatment, you have to give high dose corticosteroids before doing the temporal artery biopsy. Okay, so this high dose corticosteroid given before the temporal artery biopsy prevents the blindness. So you can see the cortisol represented by the moon, because high level of cortisol can cause moon phases. So that's why this sign should represent the corticosteroid. Okay, moon sign. So you can see the moon is blessing the woman, so that should remind you of the high dose corticosteroid can prevent the blindness. Okay, and it is said that the production of cytokines, that is interleukin 6, involves in the pathogenesis of the disease. So there is a new treatment called tocilizumab. Okay, so how to remember this drug? So you see the jaw claudication, she cannot talk. Okay, she cannot talk because of the jaw claudication, pain in the jaw. So that's why we help her to make her talk. You give tocilizumab. So that is how you remember this drug. Okay, so this is actually anti interleukin 6 monoclonal antibody, tocilizumab. Okay, so this was all about giant cell arteritis. So as I read through the lines in the book, you should remind yourself of the image. So it affects usually elderly female, that's why the female character, and 70 years, more than 70 years old should be reminded by the 7-shaped cane, unilateral headache, possible temporal artery tenderness, jaw claudication, and that is why she cannot talk, and that's why the drug was tocilizumab. That is how we remembered, right? So may lead to irreversible blindness due to ophthalmic artery occlusion, and that's why we painted the eye in black. Associated with polymyalgia rheumatica, so girdle pain, may most commonly affect branches of carotid artery, and that's why there was carrot in which the woman was walking. Okay, and there was focal granulomatous inflammation of the media, and it is not written over here, but there is fragmentation of the internal elastic lamina. So as this is an inflammatory disease, there is a raised ESR, so that should not be a problem to remember. And treatment with the high dose corticosteroid prior to the temporal artery biopsy to prevent blindness. So this was all that you need to know about the giant cell arteritis. I hope this video was helpful. So if you find this video good, hit the like button, and if you have not already subscribed, then subscribe to my channel. Thank you very much for watching.